Wow, it's a great day. Welcome to our YouTube channel. In today's video, we shall be talking about bite. But before we go to the one that we'll be talking about, let me quickly rush through about the types of bite. As we all know, we have different types of bite, such as human bite, snake bite, dog bite, scorpion sting, bee sting, and at the same time we have other types of bite, such as insect bite, which can be mosquito, ants, etc. So but majorly in this video, I'll be talking on snake bite. First aid or emergency treatment and management for snake bite, both in hospital or at home. This video serves as a lecture materials for medical students, nurses, community practitioner, public health practitioner. In a simple term, snake bite is an injury caused by bite of a snake. So in this video, I'll be talking about measures to take at home and do's and don'ts in snake bite, what to give and how to give anti-snake venom, common type of snakes. All these things are what I shall be explaining in this video. So what can you do if you have someone with a snake bite at home? Pay attention to the following procedures. First thing to do is to reassure. You have to reassure your patient. And why do you have to reassure your patient? You must reassure your patient in order to allay their anxiety. You know, most time when this thing happens, the patient will be panicking. So the first thing you have to do is to allay the patient fear, or you allay the person, you allay the fear of that person. The second thing you have to do is you clean the wound with clean water. And thirdly, you have to immobilize the limb while the patient is transported from the site of bite to the hospital. In immobilization, you need a splint and a straight rod or stick and a bandage. What you do is you place the rod beside the limb that has been beaten. Then you wrap the bandage around the leg. Now take a look at this picture. You can see, firstly, they firstly wrap a bandage before they apply the straight rod. So you follow this same process in immobilizing the patient's leg. If the site of bite is at the arm, after the application of the bandage and the rod, ensure you place the arm in a sling, as it is in this picture. In cases where you couldn't get a rod or a splint, after the immobilization of the site of bite, you can now apply another bandage together with the other limb, as you can see in this picture. Ensure the patient is lying down while you are applying the bandage and the splint. What is the purpose of this immobilization? The purpose of the splint and bandage is to immobilize the leg, and this should be tight enough to include the superficial lymphatic presence in the skin. It should not be too tight to prevent blood supply to that limb, because once it is too tight, it can cause more harm to the patient than good. Do's and don'ts or myths in snake bite. The tradition of tying a tonica to the patient limb which has been bitten by the snake is not advisable, because it causes more harm to the patient. Why? When you tie a tonica to the arm or limb that has been bitten by a snake, the anterior and venous supply is cut off. Then you will see the patient will start developing swelling around the limb or arm. When the patient is brought to the hospital and the tourniquet is removed, there is a gouge of poison and venom into the circulation, and this causes death of the patient. So tourniquet is a harmful technique which must be discouraged. That's why it should be replaced by a bandage. Now, what to do if a patient with a snake bite is brought to your health facility with a tourniquet tied around the limb or arm? You must not remove the tourniquet directly, please, because once you do that, there will be gush of the poison into the circulation. In this case, what you should do is to get a blood pressure curve and wrap it above the tourniquet. Then you inflate the PP curve and you remove the tourniquet. Then gradually you now deflate the PP curve. Once you do this will make the poison to enter slowly into the body. Other myths, that is, other things are not advisable to be done while there is a snake bite, like cutting the wound, squeezing wound, sucking the poison out of the wound, using a cold compress on the bite, and sometimes some people will raise the area of bite above the victim's heart. Please do not raise the area of bite above the victim's heart. Attempting to catch the snake. Please do not attempt to catch the snake, because if you do that, this will cause delay in transporting the patient to the hospital. And once there is delay, this can cause more harm. That is, it will make the condition to become worsened. All these methods were formerly used or recommended, but it is now believed that they are more likely to do harm than good. So this method must be discouraged. Majorly what you do when the patient is outside the hospital, that is before moving him or her to the hospital, you do wound cleaning and limb immobilization. So this is what I've been explaining since. Now the next thing I'll be discussing now is how to manage patient with a snake bite at the hospital. What are the things that you should do? Once the patient gets to the hospital, what you are expected to do is, firstly, you adopt the ABCD approach, where you check the airway, you check for breathing, you check for circulation, you check for disability, that is the level of consciousness. Thereafter, you take the vital signs, the blood pressure, the pulse rate, temperature, and the respiratory rate. And under the respiratory rate, your attention should be more on the single breath count. You have to take that too, very important, because many patients are bitten by a snake that has neurotoxin in them, and this can cause respiratory paralysis, and this patient will need a ventilator. So in assessing single breath count, you ask the patient to count up to 30. That is 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Normal individual can count up to 30 in a single breath count. So if the patient cannot count up to 30, it means the patient is moving towards respiratory paralysis, and this kind of patient will need a ventilator. Another thing you do in the hospital when the patient is brought to the hospital is you take brief history, most especially history about the snake, maybe the color and the likes. Commonly found snake in our region are neurotoxic or immobilization snake. Neurotoxin is a venom which acts on the nervous system and can cause muscle paralysis and unconsciousness. An example of neurotoxic snakes are cobras, coral snakes, mambas, sea snakes, and crate. Now take a look at this picture. This is a picture of a cobra. Cobra usually has a classical appearance. They expand the neck ribs to form a hood. They have a short pharynx in the front of the upper jaw, and it's about 3 to 5 feet long. And usually they raise this hood when they are being threatened. Common signs and symptoms of neurotoxins are frothy saliva, slurred speech, respiratory failure or paralysis, severe pain, and paralysis of the body. Diplopia. While immobilization are venom that destroy red blood cells, and it causes hemolysis, disrupt blood clotting, and also can cause organ collapse and tissue damage. Majorly, what happens under Immobilization is just that they cause bleeding. That's what they do. In this aspect, when you pass IV line for this kind of patient, you see they will be bleeding from the site where you pass the line. And sometimes you might see conjunctival hemorrhage or hematuria epistaxis or bleeding from the gum. Example of hemotoxic snakes are vipers, including rattlesnakes, copperheads, cottonmouth, vipers, pit vipers. And hemotoxic snakes, they make their prey to bleed to death. Most time, as I've finally said, patients with hemotoxin, they bleed from the bite of mark. And a patient bitten by a rattlesnake, you will notice 1 or 2 puncture marks made by their large fangs. The common signs and symptoms of hemotoxin are swelling, pain, excessive bleeding, bruising, difficulty in breathing, blurred vision, salivating, weakness, lightheadedness, numbness in the face or limbs, sweating, nausea, and vomiting. Note that both venom can be deadly. After understanding the mechanism of action of these snakes, the next thing is to carry out lab investigation. And you carry out lab investigations like full blood count, bleeding profile, urinalysis, renal function test, liver function test, CPK level. Don't forget we are still under the management of snake bite at the hospital. Remember, I've talked about the adopting the ABCD approach, checking of the vital signs and taking of history. At the same time, once the patient is with you, you gently wash the area of bite with soap and water if possible. Ensure you remove tight clothing and jewelry because the area around the bite is likely to swell. You keep the bite area below the heart if possible. You lie the patient down. And at the same time, you keep the biting area still and lower than the heart. That's where the immobilization that I've talked earlier come into play. You cover the area with a clean or cool compress dressing in order to ease swelling and discomfort. You monitor the breathing and heart rate. Watch for systemic symptoms as well. Then you cannot give antivenom. Antivenom depends on the type of snake involved. Antivenom can be cytotoxic, neurotoxic, cardiotoxic, or hemotoxic. In administering anti-snake venom, you can administer polyvalent anti-snake venom in cases where the snake cannot be identified. So, you withdraw a 50 ml of anti-snake venom and you dilute in 500 ml to 1000 ml of normal saline or dextrosaline or dextrose water, and you give it in slow IV infusion. Please note you must have antihistamine at hand while you are administering anti-snake venom. Antihistamine like hydrocortisone or adrenaline, or better still, you can give hydrocortisone prior to the administration of anti-snake venom. If there is an anaphylactic reaction, you stop the infusion and give antihistamine. Keep the patient under observation for at least 24 hours. Together with the treatment, you give tetanus diphtheria or tetanus toxoid prophylaxis, and you also give antibiotics. You must also have this in mind that not all bites are venomous. If the patient is in shock, you give IV fluid and anti-snake venom, but you must decide if the bite is venomous or not. Finally, you cover the site of bite with a clean dressing. You apply a dry bandage as well. Then ensure you still immobilize the limb or the site of bite. Also note that virtually all snake bite has common signs such as wound at the site of bite, puncture, swelling, redness, warmth, bleeding, and pain. In this video, I've been able to talk about the types of bites, types of snakes. Then we've been able to talk about measures to take at home or at the hospital if you have someone with a snake bite. Talk about do's and don'ts and all the myths in snake bite. Then I've been able to talk about how to give anti-snake venom and the common types of snakes in our community. I'm very sure you have gained one or two things in this video. If yes, kindly like, comment and share this video with your friends and your colleagues. Thank you and God bless you. See you in our next video.